Hello, my name is Dr. Philomena Swarbrick. I work here at St John's Hospice and I have done for the last 5 years as a senior specialty doctor. So we've got some documents that will help us in getting all of this advanced care planning written down if that's what the patient wants. The first document is the preferred priorities of care. This is a statement of wishes, and I feel that this is the most important part of advanced care planning. It's a very positive, helpful document for patients. They can write in it, healthcare professionals can write in it, their families can write in it, and it can state all sorts of things that they think that they would like as their life is drawing to its close. For instance, exactly where they would like to be cared for, who they would like to have around them, what sort of things they would like to have in the room, flowers, people partying, lots of noise, or would they like peace and quiet, and any spiritual or religious rites. Remember that advanced care planning doesn't have to be written down, but if this is written down, it doesn't have to be in this particular document. It can just be on any sheet of paper. It can be in a journal or a diary. It can just be spoken of by the patient and you can get permission to write it down in your notes. Remember also that patients can't actually refuse certain things with this document. They can never refuse basic care. It is a healthcare professional's duty to provide good basic care and hygiene for all patients. A second document that we've got in advanced care planning is perhaps one of the most controversial, the Do Not Attempt Cardiopulmonary Resuscitation document, DNA CPR. And this has received a lot of attention over the years and is still doing so in recent times. This document is written by doctors for a patient, but it should always be discussed with the patient where that is possible. If it's not possible because the patient is mentally incapacitated, then it is now law that families are involved in those discussions and absolutely know why that form is being written. Doctors write a DNA CPR because they believe that trying to do CPR on certain patients will be actually more burdensome than helpful. CPR is a very traumatic experience, breaks bones, and can make people much worse afterwards if they do recover. Most patients with terminal illnesses, widespread cancer, or multiple organ failures, or perhaps just very elderly with a lot of comorbidities, are very unlikely to come round with CPR. And if they do, they're likely to have a lot of problems and be in more pain than they were before. All of this needs to be explained gently and carefully to help patients and families understand why CPR is not the right procedure for their family member. Remember that when patients are dying, their heart is going to start to fail, and the CPR document, the Do Not Resuscitate document, was created in order to prevent damage to those patients who are trying to die a natural death. That very traumatic experience should be a patient's right to be able to refuse in advance. Where there is any doubt that CPR may or may not be of benefit and the patient does want CPR to be attempted, then of course the medical team should go ahead and do that. So I hope you can see from this that it's very important that advanced care planning and particularly the DNA CPR must be done on an individual basis, on a one-to-one basis with every patient entering a new care environment, that these forms cannot be written without the patient's knowledge, without meaningful conversations, and cannot be done for whole groups of patients. So in addition to those two documents, we also have the Advanced Decision to Refuse Treatment document. This is the only one which is a legal document. It has to be written in very specific language, so it's best if it's done with a patient by someone who really knows them well and who knows their condition well and can answer questions about it. It must be signed and it must be witnessed. And it can refuse very specific treatments that the patient doesn't want. It can be used to reinforce the Do Not Attempt Resuscitation form. The fourth document in the pack is the Emergency Healthcare Plan. This is simply a list of treatments that can be offered to a patient in a specific emergency that might happen to that person, perhaps in their home, that helps those around them, give them the best treatment and may prevent admission into hospital. Finally, patients can apply to have a lasting power of attorney. This is a procedure that they must do themselves. They have to apply to the Office of Public Guardian. It can be done online and it can be done on paper, and it should be done with the people that they want to appoint as their powers of attorney. It can be more than one person. This document has to be registered and paid for. It's about £100 and it takes about 6 weeks to come into effect. This means that the persons listed in that document can speak on behalf of that person as if they were that person if that person becomes incapacitated. This document can also be changed at any time by applying to the office and having it changed. So finally, I'd like to say that all this is quite complicated, it's quite detailed, it's quite difficult. Not everybody wants to do this and nobody has to do any of it. Remember that when you're trying to make any care or medical decision about your patients, that you need to gather as much information about them as you possibly can if they are unable to speak to you. So that means reading previous notes, talking to all of their loved ones, looking into any advanced care planning that they've already made, and gathering all possible information in this way to make the best decisions, often with their nearest and dearest, even if they aren't lasting powers of attorney. And so finally, I'd just like to say that it's a brave thing to do. We all need to do it. If you do it gently with someone and ask questions, you'll never upset anybody. Everybody likes to be given the right to have their say. And although it's difficult for them and for us, it has huge benefits. I think it's the right thing to do, and I think it's what we would want people to do for us. Thank you for listening.